Okay, hello everyone. Thank you so much for joining us today. We're excited to welcome you. My name is Terry Lynn Macmillan. I'm an outreach and education advisor with the student recruitment team at Mohawk College, and I'm joined by our electrical and computer engineering associate dean, Elizabeth Martin, along with the program coordinator and faculty for our brand new Bachelor of Digital Health degree program. Mohawk's new four-year degree program combines computer science, health, and business to give you the skills and experience to design and develop IT healthcare solutions. Before we get started, this is just a reminder to participants, if you could kindly keep your video and microphones turned off through the session. You're welcome to use the chat feature to ask any questions throughout the course of the presentation, and we will get to answering them once the presentation is completed. We are recording today's session for future use and for it to be viewed on our program pages. At this time, we cannot confirm what the program delivery model will look like for September 2021 programs. Mohawk College is making program delivery decisions on a semester to semester basis, determined by the recommendations we're given from public health and the government. If entering a program that may have components delivered through a virtual platform, please know that the plan is flexible and can be easily scaled up or down to accommodate any changes along the way. You can be confident that our new learning styles will meet the learning outcomes for your program while ensuring the quality educational experience you expect from Mohawk. I'd encourage everyone to check updates about COVID-19 on the Mohawk College website. A link for frequently asked questions will be available in the chat for your review. If any international students are joining us today, welcome. We do have one of our international market specialists with us, Maggie Chen. She will be able to respond to questions and share resources. Details on admission requirements will be reviewed in the presentation and can also be found on the program page. Now I will hand it over to Elizabeth Martin to provide you with more information about Mohawk's first degree program.
Thank you so much, and welcome to everyone who's joined us today to learn a little bit more about our Bachelor of Digital Health Honors Program. So we're going to be sharing with you, this is the first standalone degree program that we are offering here at Mohawk College, and we're extremely excited to welcome students onto campus, or at least virtually, this coming fall. And as was just mentioned, we're ready to meet you regardless of how. So, as we evolve over the next 6 months or so, we'll have a much clearer concept of where we'll be with that. But just know that regardless of which avenue we take, the faculty and the coordinator and I are all very excited to have students join the program and are very ready to help you conduct your learning, regardless of whether it ends up being in a virtual environment or a face-to-face environment, at least at first. So this program is a four-year program, and we're going to take you through some of the details of the program. But first, I'd like to introduce you to some of the faculty members that will be teaching into the program, and we'll have them share a little bit about what they're teaching along the way. So first, I'd like to introduce Joe Verasso. Joe is a professor in the Computer Science and Information portfolio at Mohawk College, and Joe is also the program coordinator for the new digital health program, and he'll be teaching computer science into the first and fourth year of the program. Minnie Thomas is joining us. She has expertise in human and machine interfacing and robotics, and she also is familiar with the hospital setting and app dev space. So she'll be teaching a variety of classes into the program as well. And Sadiq Raji has a significant background in the data component and the analytics component of what goes on in the healthcare system. And he can share a little bit more about his own experience as well, and his background and familiarity with the work setting. So we'll have each of these experts share a little bit about their knowledge base and what they plan to be doing within the program. And we also just want to give you a general sense of what to expect if you decide to join us for the program. So with that, I'm going to turn it over to Joe Verasso, who can take us through some of the slides. We'll go through some of the material just to make sure that you have information about the program at first, and then we'll have some time for your questions afterward.
Thanks, Liz, and thank you all for joining us. Could we advance to the next slide, please? Okay, so a number of questions that you may be asking yourself about this program, as we did as we went through this journey in developing the program. One of the obvious questions is why? Why introduce another program? And there are several reasons why. So digital health is a rapidly growing field. So we see that there's huge opportunities for our students in the area. It's vitally important these days in terms of delivering healthcare in a modern and efficient manner. Mohawk has a lot of expertise in digital health through our Medic Research Center. And also Mohawk has recognized strengths in both technology and healthcare. So we felt that developing a program like this really spoke to Mohawk's strengths in healthcare and technology. We also have a wonderful set of labs, and you can see one of the labs there on the right, which is called our Mobile Device Experimental Lab. So we think we're going to bring wonderful hands-on experiences to our students. So in summary, we wanted to leverage Mohawk's established strengths in digital health, and we thought this program was a great way to do it. Next. Okay, a little more background as to why we did it. We also feel that the program is really timely. So of course, these are unfortunate circumstances and no one's happy about the current crisis that we find ourselves in. But nonetheless, COVID-19 has led to an explosion in digital health adoption. And consequently, healthcare is being rapidly transformed in terms of how it's delivered around the globe. And I think around the world, there's increased awareness of just how important this field really is. And consequently, we believe that there's increased opportunities for students and for graduates to work in this exciting field. And there's been a number of recent articles basically highlighting the importance of digital health, but we've tried to capture one of them here from the New England Journal of Medicine that talks about COVID-19 and the digital health revolution that it's causing. In terms of how we designed the program, we spent a lot of time trying to ensure that the program was architected in the best possible way for students and graduates. So the program is highly interdisciplinary to reflect the interdisciplinary nature of digital health. So one way to look at the curriculum is to envision it as a stool. So it's an analogy that we often use when looking at the curriculum. So there are three key legs to the stool: computer science, business skills, and health. And so we try to ensure that the curriculum speaks to those three essential elements. Lastly, we have the seat of the stool, which is the applied learning and research elements that essentially bring the legs together. So with the applied learning, you're going to be able to apply all of the skills that you learn in computer science, business, and health to the digital health domain. Okay, so what does that mean specifically? So some of you are probably wondering, okay, the stool is great, but what does that mean in terms of courses that I'll actually be taking? So we've tried to show you at least what the first year would look like. And so I'll run you through some of this and defer you to some of, we're fortunate to have a couple of wonderful professors here as well who can speak to the courses. So I'll defer to them momentarily as well. So in first semester, there's a programming fundamentals course, which I feel very passionate about because I'm slated to be developing it. And for that particular course, we're going to be using Unity, which we feel will be really engaging for students because it's a very popular gaming engine, but it also has great applicability in the digital health space. So we've chosen Unity for this course because we think it'd be fun, engaging, and appropriate for the field. There are a number of other courses that we wanted to speak to in terms of the communications course, of course, which is essential in any degree program. And maybe I will turn it over to Minnie Thomas, if you wanted to speak to a couple of the courses that you're slated to work on, Minnie.
Okay. Hello, everyone. So my name is Minnie Thomas, and I'm also equally excited as I'm thinking most of you are here for this program to begin with. And some of the courses which maybe I am slated to develop and teach are the digital health courses in relation with digital health devices, telehealth, and things like that. So I have experience working with clinicals and remote monitoring patients for various projects, and in relation with some of the researches which I have done with Hamilton Health Sciences. So I'm thinking those experiences will be brought in while we teach these courses. And so what we are basically planning in these courses is collecting or having remote monitoring as is very crucial and important in this phase, what we understand how this can help for virtually analyzing or collection of data, and then maybe an automated system or things like that. Also something in relation with the user-centered interface in terms of patient and the healthcare. So these are some of the courses which are slated, and I will be developing them in the winter and for the upcoming semester to be taught. And my background is in electrical and computer engineering, and I am currently doing my PhD in digital health, in software engineering actually, but specialization in digital health, especially focusing on automated medical advisory systems and the trust and security issues related with that. So I'm hoping I can bring in some of the expertise from that area into developing and teaching this courses in the various semesters of this program.
Thanks, Minnie. Sadiq Raji is another one of our stellar professors who's slated to teach and develop in the program. Sadiq, did you want to speak to any of the courses in the first year and a little bit about your background?
Yes, good morning, everyone. My name is Sadiq Raji, and I'm a professor here at Mohawk College in the Computer Science Department. My background is in health informatics, so my undergrad from York University is in health informatics, master's from Dalhousie, also in health informatics, as well as I'm completing my PhD hopefully in the next few weeks in health information science at Western. And prior to joining Mohawk, I worked for almost 7 years at the Canadian Institute for Health Information. So this is a field that I'm really passionate about and I'm very familiar with. I will be developing the course on digital health fundamentals, as well as the Canadian healthcare system, which will be an introductory course to digital health students. The courses generally will focus on digital health, including our understanding of how we acquire and store and use, as well as transmit health and biomedical data. It's going to include topics related to this digital health decision-making within hospital settings, as well as within broader health information settings. We'll, of course, discuss topics related to computer architecture related to healthcare, as well as standards related to biomedical information, as well as digital health information. So the courses are going to be very interesting. We'll also look at electronic health record systems, as well as electronic medical record systems, consumer health information, telehealth, imaging, all those topics that make health information interesting and relevant to not only solving health problems, but also helping students to develop the skills to apply computing as well as general information science into health system analysis and resolving issues in healthcare. So I'm looking forward to the program and looking forward to welcoming our students, and hopefully it's going to be an excellent experience for everyone.
Thanks, Sadiq.
Can I just interject for 1 second, Joe? I just wanted to say the faculty are mentioning that they're slated to develop, and I wanted to comment on that. This is such a rapidly changing field that one of the things that we're very committed to is making sure that the courses that we're developing are relevant time that you're going to be learning them. And so we have a very robust plan, and as you can see, we have extremely knowledgeable faculty, and we've been amalgamating information, but the intention is to make sure that the courses you're getting are up to date and are current based on the emerging needs of the market. And in the healthcare space as well as in the digital space, if you're not as familiar, these things change extremely rapidly. So I'm very grateful to have an active faculty who are going to be taking a guiding hand at this. And as they mentioned, for some of the classes, we've already developed them, and for some, we're in the process of developing them in the upcoming term. But everything will be ready to go when you arrive in the fall so that you can be fully immersed in these classes.
Okay, one of the questions that you may be wondering as well is who's going to be involved in this program? And fortunately, you've met a few of us here on this call that are going to be involved in the program, and we're primarily from the computer science area. There's also going to be a number of faculty from the health area, from liberal studies and mathematics as well, that are going to teach you courses in their relevant fields of expertise. So this is truly an interdisciplinary program, and the faculty group will reflect that. We also have researchers from Mohawk's Medic Research Center, and we are going to be collaborating with them as well to potentially bring some of their experiences into the classroom too. We have a number of industry partners in healthcare that we're going to be talking about a little bit later. And, you know, perhaps the most important element in all of this is all of you. So we're confident that we're going to have a wonderful group of engaged students from all over the world. And, you know, together, we believe we're going to represent this program really well and show the world what a leader Mohawk is in this space. A little bit more about some of the contributors. So specifically on the MEDIC side, MEDIC was established in 2009, and it partners with government, public health researchers, and others specifically to develop healthcare IT solutions. And you may not be aware, but MEDIC is actually Canada's one and only digital health technology access center. So clearly there's a lot of confidence in terms of MEDIC's ability to deliver healthcare IT solutions and their expertise in the field. Okay, the admission requirements, and they're all listed very carefully in terms of what's required. One of the things that's really important here, and I'm sure that all the faculty would echo this, is that at Mohawk, we've all encountered many excellent students with tremendous potential who, for whatever reason, didn't qualify in some cases for some traditional university degree programs. So we've tried to ensure that the requirements for our program are more accessible and will give more students an opportunity to really learn from a great program and demonstrate their potential. So in terms of the requirements, we're looking at a grade 12 English, any U-level English from grade 12, and one math course, and that needs to be either the calculus and vectors or the advanced functions course. Any grade 12 U-level science, so that could be chemistry, biology, physics, etc. And then 3 additional high school elective credits at the U or M level. Then the average requirements are also listed. So we're talking about 70% and higher in each of the required courses and an overall average of 70% or higher. We recommend that you take a computer science course in high school. We think it would make your transition to the program easier, but it's not strictly required. The next slide, we're going to have our representatives from international speak to the international requirements. Maggie?
Thank you, Joe. Thank you, everyone. It's such exciting news to me and to international. We opened the first degree, a bachelor degree program to all of our students, especially for international students. We believe international students, we're on the same page, excited to waiting for to apply for this program. My name is Maggie. I'm from International Department. A marketing specialist, take care of region of China. I do have other colleagues and also take care of other part of the world and other regions for our international students. Talking about admission requirements, as Joe mentioned that if international students who are applying from in Canada high school, the admission requirements will be same as domestic students. If students have a grade 12 English, and it will be equivalent to IELTS 6.5. For students who are not applied in country in Canada from other part of the world, overseas students, definitely we will require for either IELTS 6.5, no band below 6.0, TOEFL, IBT, CAIL or CLBT, and the PET. For some students, they might not able to meet our English requirements at the moment, no worries, and students also could take our EAP program first. Once the students successful completion level 8 of English study at Mohawk College, and the students also could get into the program later on after the EAP study. Yes, and next I will hand back to Joe. Thank you.
Thanks, Maggie. Okay, we wanted to speak to the market opportunities and growth, and we think that this slide gives you somewhat of a taste of just how much this market is growing. So this data was collected by Global Market Insights, and it tries to summarize the growth in the digital health market from 2019 to 2026. Also, it's worth noting that this data is very current. It was taken from June 2020. And what they're forecasting is the digital health market is growing extremely rapidly. So in 2019, it was a $106 billion industry. By 2026, it's supposed to grow to over a $600 billion industry. And the overall growth rate is just under 30%. So clearly, this is a very rapidly growing field. And you look at it, breaks down the different areas here in terms of app segment, telehealth care segment, hardware segment, health analytics segment. All of them are growing rapidly. And we're very confident that our program speaks to all of these different areas. So as our students are going to get a background in all of these high growth areas, we're really confident that there's going to be lots of employment opportunities for our graduates. Job opportunities. So I left industry in 2010, and consequently, we have one of our faculty members here, Sadiq Raji, who's got more current experience in the digital health field. So Sadiq, did you want to speak to potential opportunities in the digital health field?
Yes, the career options are broad and wide ranging, depending on the interests of the student and the opportunities that are available. You can have a career that's tailored around computer science, or a combination of health as well as computing. So some of the career options that are listed here, clinical systems analyst is really very popular these days. Myself, I was an analyst at the Canadian Institute for Health Information, where we're responsible for managing health information databases. So databases related to health, clinical health, as well as health information and health information at the population level, as well as health human resources, as well as health, financial resources and management. So the opportunities are really broad and wide ranging. If you're inclined towards programming, then you could be managing you could be creating those information systems, not only at the back end, but also the front end, like information visualization systems, as well as even managing databases and things like that. So those career options are really very wide ranging, like I mentioned, and with more interest in having solutions that are available in a remote settings, because now with COVID and all the different challenges that it brought about, it brings opportunities for someone who is part of this program to land a job, basically, not only with government, but also with hospitals as well as businesses. So some of the career options that are listed here: the clinical systems analyst, information systems analyst, application developer. You can have a health systems specialist, as well as project management within IT and IT consultancy. And of course, the employers are not only government, but also research institutions, medical clinics, academic research places, as well as the government. Institutions like Canadian Institute for Health Information or Digital Health Canada, or in other provinces, they have, like in Alberta Health Services, they have their own health information management groups that will hire students graduating from this program, and you could do analysis, or you could be a programmer, or you could be an IT consultant or a project manager. So the opportunities are growing, and for some reason, I feel a lot of people do not know how to articulate exactly what digital health is, so they don't really realize that the opportunities are there because they really don't know what it is. So this program provides an opportunity to learn what it is and to open up to those opportunities that are there for job, especially.
Thanks, Sadiq. I know that Minnie and Liz also have experience in this field. Did you want to add to Sadiq's comments, Minnie and Liz?
Sure, I can say something for a minute. So I did a health sector management MBA at Western, and then I worked at a not-for-profit, the Center for Surgical Invention and Innovation here in Hamilton, that works with St. Joe's Hospital. And we also have very close connections with the PAC, with our professional advisory committee members, and we have representation from all of the hospital systems in McMaster as part of that collective. So we're working very closely with our employer partners to understand their needs and to try to dovetail what we're doing in the program so that the students who graduate from the program are in the best possible position to succeed in these new and emerging jobs. And some of what we've heard from our partners is that, you know, it's difficult to find students that have this complement of skills right now. A lot of people will have the computer science, or they'll have the business, or they'll have the healthcare background, but it's challenging to find someone that knows about all three areas. So this program really is a unique opportunity to position yourself for these careers and to learn about the different elements that make up all of these jobs. So, you know, as Steve mentioned, some of them will be a little more computer science oriented, others will be a little bit more healthcare oriented or a little more business oriented, but having all three of those elements is completely necessary for all of these jobs. So, so that really is the uniqueness of going through an interdisciplinary degree.
Thanks, Liz. Minnie, did you want to add something?
Yeah, I would just add on to what Liz said. So this program, I think, will give you a big picture, an overall big picture on all the three areas, and then how and where exactly you feel, or any one of us feel passionate about to grow into. That is based on our expertise. But I surely would like to add on that as remote is increasing, like the digital health has taken up a big leap, and in terms of data, in terms of IoT, in terms of whatever, all those things. And therefore the leap which Joe was mentioning, which is going to be about 30%, is itself a big window, which tells us that whether it is in computer science handling data, or it is in remote monitoring with hospitals or clinicals, or it is with the business aspect. Yesterday I was in a conference and about all the business aspect of how do we handle this data in terms of AI and things like that. So it's what we will grow into this journey together, and we'll understand where each one of us will fit best.
Thanks, Minnie. Okay, so we've provided on this slide a number of contacts for you, so please feel free to reach out to us. If you were to follow these links, you could reach us a number of different ways. You know, we're all here to support you. And one of the things that I think hopefully you've learned from this presentation is that there's a whole lot of excitement, enthusiasm, and commitment to this program throughout the college. So if you're interested, please feel free to reach out, and we'll be sure to have your questions answered promptly. Okay, now we'd like to turn it over to all of you for your questions.
Is there a co-op or a work placement, and is the paid placement, is it a paid placement, and what are some examples of where they can work?
So great question. So at the moment, the way the program is structured, we have unpaid work placements, and we did this for a reason, because we want to ensure that students can find placements that are relevant for the field. So one of the drawbacks of traditional co-op employment is that a lot of times the co-op opportunities may not be relevant to the discipline. But at the same time, we are going to unofficially help students to try to find paid co-op opportunities as well. And in terms of some of the projected employers, we have a number of partners that we're working with that have hired our students in the past. So I would look to some of them like Hamilton Health Sciences, Population Health Research Institute, Able Healthware, eHealth Ontario, our very own Medic at Mohawk that we've been talking about, along with many of our traditional co-op employers in the computer science area. So some of those would be Avenica, Concentrix Canada, the City of Hamilton, Dofasco, and Everts.
That's great, thank you. Can you provide some examples of what the capstone projects will be that students are working on?
Absolutely. So for the capstone projects, as we talked about, this is an interdisciplinary field. So we expect a wide spectrum of projects, but some of them might include building digital health applications. So applications for monitoring systems, information for patients, training applications for staff, also data analytics on healthcare data. So reviewing the data and trying to draw some conclusions. And of course, AI is a big element of that these days as well. So perhaps applying AI to some of these data sets. There's also systems evaluation and design. We expect that some students may get involved in process review for different organizations to try to make some suggestions for improvements. Also, data security audits. So of course, privacy and security are paramount when we're dealing with the healthcare area. So we anticipate that there are going to be some capstones related to that as well.
Can you speak to any industry partnerships that they have in this program?
Yeah. Liz, did you want to speak to that?
Sure, yeah. So the first thing I'll mention is that we're in the process of developing even more industry partnerships, but we have large scale partnerships with the local hospitals. So as Joe mentioned, some of the same employers are our partners in developing and collaborating. So Hamilton Health Science and PHRI, as Joe mentioned. We also have strong relationships with St. Joe's Hospital and McMaster University. And so we're in the process of bringing even more partners on. The other thing I'll mention is that we also have strong relationships with a lot of forward-looking organizations like KPMG and other consultancies that are looking at where we're going with healthcare as well. So the idea is we want to have strong relationships and partnerships with people who will employ our students and who work in the digital health community. And then we also want to have strong relationships with the thought leaders who are looking at where the industry is going, so that when you graduate from our programs, you have those cutting edge skills that you need to really enter the workforce strong and make a huge difference to patients and to the into the institutions that you are working with.
Thank you.
I see it. Yeah, GJ has a question. If you'd like to share your question.
Hi, my name is GJ and I'm a market specialist for Korea and Japan. And could you go back to the admission requirement page? Yeah, in here, there is the one requirement, 3 additional high school elective credits. Could you explain a little bit more about this?
Certainly. So as you know, in grades 11 and 12, students have the opportunity to take some additional credits. So that course might be in computer science, it may be additional science course, it might be a business course that they're interested in, it might be healthcare related. And these courses, the way we've set it up, they could either be grade 11 or 12 courses, again, to try to make the program a little more accessible to more students. So there's a number of different courses, a number of different electives that students in high school have. And as long as they're at the U or M level and grade 11 or 12, they have 3 of them and the overall average is over 70%. That would meet the requirements for admission.
So this doesn't mean only limited to science or business or health. Any course outside of those categories?
Absolutely not. It could be a course in religious studies. It could be another course in communications. As we touched on, you know, communications is important in most fields. So it's not limited to those 3 areas.
Okay.
One way of thinking about it is that the first 3 classes are really skill set specific, and the other 3 classes are telling us that holistically, a student who's entering the program will be able to succeed in the program because they're capable of performing at the level we know they'll need in order to successfully navigate through the workload in the program.
Okay, thank you very much.
I have a question regarding to international applicants. Let's say if for students overseas and in different education system, if they don't have 3 additional high school elective credits, are we considering other like a grade 12 or 11 courses equivalents to?
Yeah, absolutely. If it's not specifically labeled as an elective, it's still eligible. So when we're talking about elective credits, we're talking about courses other than the 3 main streams that we've identified here. So we've got English, math, and science covered. And what we're looking for is other disciplinary skills beyond English, math, and science, where the student has also succeeded.
Great, thank you. And also for the grades and for international applicants, they must also above 70% and up. Is that correct?
Yeah, so this, Joe, you can go ahead.
Yes, so per the domestic requirements, so whatever the analogous would be for international students, whatever the comparables would be.
Great. Thank you for sharing. Good to know.
We do have a few questions from Abby in the chat. So maybe if we could just go through them one at a time. The first question is, if we have a plan for mature students at this time, I guess what I'll just say is we are a certified program, so we do have certain admission requirements that we have to uphold. If you're coming in as a mature student, there are ways for you to demonstrate university level eligibility. And if you don't have that experience, there are courses that you can take to give university level prerequisites that you can take through the college. So if you are lacking some of those prerequisites, it would be worth reaching out to us, and I'm sure that we can provide you some information about that. If you have a prior degree from another post-grad institution, like a master's, I don't think we're going to have a problem here. We'd be able to look at your university level experiences, and I imagine we would be able to find a way to navigate through that. But again, I'd suggest you reach out to Joe into the program, and we can have a look at your credentials and give you some more specific guidance based on your situation. The second question that you had was in terms of the mixed model for online and in person. In terms of the delivery model, we've discussed the possibility of having some of the classes online, but we certainly want to preserve the opportunity for students to be on campus, especially in this program, in places where having the ability to immediately engage with faculty is of benefit, or where we're using hardware and other applications that are a little bit more challenging to teach well, and with that experiential learning component in a remote environment. So if we need to be online, we will, and we may look at certain courses as opportunities to host remotely, just to maintain flexibility for students. But there are certainly going to be some classes that we will have to have students participate in person, and that we think they'll benefit from the experience of doing them in person. So, just to give a few practical examples, we could host a first semester computer science course remotely. However, the advantage of having students in a lab and learning that computer science in a lab is that you have immediate access to that instructor when you run into challenges. Another example would be, in Minnie's class, we're procuring hardware that will allow us to do a lot of the data monitoring. And so while we could teach you about data monitoring online, and we will if we need to, the reality is that having you in the classroom, we can expose you to some of the hardware as well and give you a more holistic understanding of that experience. So yes, we'll look at flexible models, but yes, we will have an in-person component as well. And the third question is about research projects and opportunity to replace a placement. The good news is you get to do both. So Joe, I don't know if you want to speak a little bit more to that one.
Yeah, great point, Liz. So, the final year in both the 7th and 8th semester, in the 7th semester, we have the capstone prep, and the 8th semester, we have the actual capstone course. So there are 2 semesters where you're going to be working on a research project. And in that research project, you can either do an applied research project with a group working on some industry problem, or you could do more of an academic thesis. Now, as for the specific question of whether a research project could replace a placement, honestly, I think I might need to look into that. I don't know. I don't know for sure the answer to that question. We would have to see, because there are specific requirements in terms of the province mandates in this program that we need to have one work placement for 420 hours. That's the requirement for the program. So we would have to inquire to be certain whether or not that would apply and whether that would qualify. And some of it may depend on the actual nature of the research project that you're undertaking.
Yeah, I'll just interject too that we do have students in other programs that have a similar requirement where they'll have a specific interest that they're pursuing or a specific work opportunity. And so we do work with students regularly to see whether or not the opportunities that they have will qualify to give them workplace equivalent credits. And I don't expect that to be any different in this portfolio. It'll just depend on the specific situation and whether or not it meets those requirements that are set by the ministry.
Can you give us more information about how our program is different from McMaster's eHealth Master's program?
Yeah, a great question. So some of the fundamental differences would be that their program is actually a master's level program. So it's for students that already have a bachelor's degree. Whereas our program is a bachelor's program, which allows for direct entry for high school graduates. So that would be one of the fundamental differences. I should say as well that we have a strong relationship with McMaster, and I actually sit on the program advisory committee for their eHealth Master's program. And we're hoping to establish a formal pathway for our students into their program at some point. So that's something that we're going to be working towards.
That's great, thank you. Can the degree program be completed part-time?
So this is another one of those questions. As Liz mentioned, it would somewhat depend on the circumstances. So I think the answer is possibly. So some factors that would weigh in would be how many courses is the student available to take per semester? Because in this program, there are a total of 40 courses. So if a student is only available to take 1 or 2 courses per semester, that might make the time frame impractical to complete the program. And also, to what extent are they available during the day? Because some of these classes will be daytime classes. Many of them will be daytime classes. Some of them will have an online component, but there is also a significant face-to-face component. So it really would depend on the personal circumstances of the individual. How much time do they have available to study in the program? And what is their schedule like? And could they accommodate our schedule?
If I could just add to that, one of the things to consider is that we do accommodate students within our full-time programs right now at Mohawk. And again, this would kind of follow a similar stream where we can do a lighter schedule, but we do have commitments to the ministry in terms of ensuring that students complete the program within a given allotment of time. And programs are subject to change over time. So sometimes we'll have students that will start with us and may not be able to finish within the allotted time frame. And then there can be additional requirements if the program is amended or improved over that time frame. So when we have students that can't handle a full workload, we would ask them to reach out to us and we can have a look at their specific circumstances and try to suggest what a good strategy might be, or be honest if it really is something where it's impractical, as Joe mentions, and this, we can't find a strategy that would work. But the best first step would be to reach out to us and to discuss your situation. If you feel like maybe you can't handle 5 courses a semester, but maybe you could handle 3 or 4, then that might be a situation where we could have a conversation around what that might look like.
Great, thanks. How does this degree compare to other schools offering a similar program? And can you discuss what makes us different?
Great question. So because there is this rapid growth in the space, of course, there are a lot of institutions that are introducing programs in the area. So many colleges and universities have programs. The one that would perhaps be the closest to our program is the Bachelor of Applied Health Information Science from Conestoga College. And in terms of how we would differentiate ourselves, some of our strengths would be our excellent labs and our focus on applied learning. Also our strong affiliation with the Medic Research Center. And the fact that we have a 2-semester capstone project where students can really dive deeply into an industry project or take on a more academic thesis. We also have the benefit of being in Hamilton, which has a strong ecosystem in the health space, as well as, we have a strong hospital network here as well, which we think plays to our favor as well.
I just want to throw in one more little thing, which is we have excellent faculty. So just gonna toot the horn for Joe and Minnie and Sadiq a little bit here, but really just in hearing the 3 of them speak about some of their past expertise, our faculty have largely all worked in this space and have a lot of time, energy, and research experience in this space. So their capacity to add value in the classroom, I believe, is going to be immeasurable for students who are pursuing opportunities in digital health.
How does this program compare to informatics programs?
Great question. So the informatics field is obviously very broad and covers a number of different areas. So this program is, in fact, an informatics program, but it's focusing on health applications, health informatics, essentially. So we teach students about informatics applied to the health domain, things like telehealth, digital health devices, digital imaging for health, and data analytics for healthcare.
Is there an advanced standing opportunity for degree holders that are applying to our program?
Absolutely. So we would, and I think we would, we'd have to look at this on a case-by-case basis, of course, but the college does have policies around getting advanced standing for prior learning and prior experiences. So absolutely, that would be something that we could discuss with any and all candidates.
That's great, thanks. Does anybody else have any questions that they want to unmute themselves and ask or put in the chat feature?
I do have my last question. Does the students have opportunities to reach out their master degree?
Great question, Maggie, and that's something that we touched on. So we are working on building pathways for our students to master's programs. At the moment, we do not have any. But we're confident that we will have some by the time that our first cohort is in a position to graduate. So fortunately, we have a little bit of time on that front. And up until now, we've been focused on building the best possible curriculum so that our students can have the best possible experience. But now we've reached the point that because our curriculum is mature and well-defined, we're in a great position now to reach out to some of our partnering academic institutions and explore pathways. And so we will keep everybody up to date on our progress on that.
Great.
We're optimistic.
Great.
And I'm just wondering, in the interest of time here, Minnie or Sadiq, did you have anything else that you wanted to add? Any other important points that maybe we didn't touch on enough?
I think we're good. I don't have anything else to add at this point.
I think we covered most of it, and I'm sure we are all excited for what's ahead. I am, at least.
Great.
I guess the only thing that I would add, Joe, is, if you have any questions, please just don't hesitate to reach out to us. I know sometimes students will be thinking, oh, I'll figure that out later. We've got a very willing team of experts who can help find the right answer for you. And so I would just say, if you're not sure what to make of some of the classes and you're curious what's going to be covered, if you're interested in learning a little bit more about MEDDIC or some of the possible opportunities that you might have within the classrooms, things that we didn't cover in this session, certainly reach out to us and we'll try to find you the best available information, and we'll keep you posted if things change over time too.
Thanks, Liz. Next. So we wanted to close by thanking all of you for taking time from your busy schedules. We know this is a really chaotic time for many of us. And so thank you for spending this hour with us. We are really excited about this program, and we are really looking forward to seeing a number of you next fall, September 2021. So please keep us in mind, and hope you have a wonderful day, and we look forward to seeing you all.
Great, and thank you to Elizabeth, Joe, Minnie, Sadiq, and Maggie for all of the great information you've shared. We hope this leaves all of the participants confident to join us next September. We'd like to thank everyone who joined us today, and if you need assistance with next steps, the application process and deadlines, or have any additional questions, please reach out to us and we'll connect you with one of our education advisors. You can connect with us by emailing discover@mohawkcollege.ca or by calling 905-575-2460. Thank you again for joining us and have a wonderful day.